Good afternoon and welcome to another Ask the Doctors, a community update here at Whitewater Community Television's WGTV Channel 11, also on WCTV Channel 21, and we're also streaming on Facebook Live. To kind of open this, if you've kind of been with me for an extended period of time, you have occasionally heard me speak of the Queen and her court. The Queen obviously being my wife, the court being my two daughters. We were on a Zoom family conference, which is how a lot of people are doing it these days, a little bit earlier this week, and the court kind of made clear that we weren't practicing what we were preaching and they would prefer that we did. So we're talking about social distancing, being at least 6 feet apart. We hadn't been there. We actually put a tape measure on it, and you two were about 6 feet apart, and I was in between. We have actually put a tape measure on this, and from chair to chair, we are now actually 6 feet apart. So we are practicing social distancing. So the court got their wish, and we are also practicing what is preached. We are joined once again by Dr. Thomas Huth, who is Vice President of Medical Affairs for Reed Health, and Dr. David Jetmore, Wayne County Health Officer. Gentlemen, once again, thank you for taking time out of what I know is an incredibly busy schedule to be here. The community has really taken advantage of these opportunities over the first couple of weeks, and we are very, very happy that you're able to continue doing this, and that has been shown through the questions and comments that we've gotten each week, so thank you both.
Well, we're glad to do it.
Well, thanks for having us, Eric.
We're going to start. I know this is very much about the community being able to ask questions and not about me, but Dr. Huth, I'd like to start with you this week. I know a lot of people in the community are very interested in staff at Reed. They are family, they are friends, they are part of this community. Can you talk about how the staff is doing through this? We hear nationally how many health workers are getting sick, what it's doing to them as a stress level. Talk to us about your facility.
Well, overall, the staff at Reed are doing great. Really, a lot of heroes there. Many heroes in this story, but of course, they're real superheroes in my mind, especially those who work in the areas that we have dedicated to caring for the COVID patients. And, you know, they're doing great. They've adjusted very well. And I think what really helps is the community has really shown an outpouring of support. A couple of weeks ago, seems like that long ago, we had all the EMS services from around the county came and did a show of support one night, and I think it was last weekend, a group of churches from the community kind of did the same thing. And all those things are very meaningful to everybody and really shows that the community cares. And I think it helps, too, that we've put a lot of effort into helping the staff be prepared. We've got the right levels of personal protective equipment, have trained them, and through experience, they're learning that they can operate in the highly sensitive environments with the right processes, procedures, and protections. And before the show, we were discussing briefly how many staff have become sick with COVID, and I'm proud to report that we're really not aware of, except for one staff member who very early on was exposed in one of the outpatient clinics. I'm not aware of any other verified occupationally acquired cases of COVID. We have had 4 or 5 staff who've come down with it, but in each of those cases they have the likelihood of having acquired it in the community, like many of the community members are. So I think our processes are working, and everybody has adjusted very well. That's not to say there aren't stresses, because there certainly are.
Sure.
And so we're doing a lot internally to support people. We've set up a little shop by the cafe so that folks don't feel like they've got to run out to the store on the way home to get the minimal necessaries. They can buy fruit, and they can buy milk and some stuff like that to take home. And so that's just one example among many of the things we're doing to support people and make them feel like they're getting kind of special treatment.
Okay. Dr. Jetmore, kind of the same question to you. I know it was mentioned at a council or commissioners meeting that both you and the executive director, Christine Stinson, are new to your jobs. You've both come in since the beginning of the year, and we're only 4 months into the year. It seems like we're deeper into it, the way a lot of people are feeling right now. But you all kind of stepped into this. There was a move that was taking place. You were moving offices, so your staff has also been going through a lot. Talk about how you all are doing in the health department, because you're not only dealing with this, but you're dealing with everything else that is public health.
Well, there are many, believe it or not, Eric, there are many factors that make up public health besides pandemics. And we've tried to keep all of that going, but this COVID-19 epidemic has kind of has taken center stage. Luckily, my executive director, Christine Stinson, is an incredibly able and energetic person, and she has been aggressively pursuing all of the people who have been infected by this and their contacts, and keeping a handle on this. She and I, each morning, along with Dr. Huth, are part of a Zoom conference that updates us on what's happening at Reed Hospital, and also, and I think it's very important too, what's happening in the surrounding counties. Then, of course, what's going on in the state and the nation and the world, for that matter. But you're right. It's like yesterday. I didn't know how to spell health officer, and today I are one. It's been a little over 3 months, but it seems like 3 years with all that's happened. But I'm glad to be part of this and to do everything I can to help.
A couple of topics that we want to get through as we go through this hour, but the name of the show is Ask the Doctors, so we're going to bring up a couple of questions, and then there's a couple of topics I think we probably should go through. If you have questions, this is live as it's happening right now. You can send your questions to us on Facebook. You can also tweet them to @WCTV Info. That information will appear at the bottom of the screen periodically. If you've got the first question that has come in, let's do that. What if you have some other possible problem and can't get an appointment with your doctor? What if you have some other possible problem and can't get an appointment with your doctor? If you're feeling sick, if you're, and this is allergy season for a lot of people, and even those are incredibly difficult for folks.
Right. You know, our medical needs don't go away, do they, during a pandemic? A lot of people have had to reschedule and avoid non-essential medical services for the time being. But I think we will be getting back to that in the fairly near future. In the meantime, what we're doing at Reed is we're providing a lot of telehealth. In fact, the majority of our visits now are via telehealth means. We have an app called Reed Health Now, where regular appointments with doctors can be done. And some of the doctors are using an alternative to that, but still there are different ways. And actually the federal government issued blanket waivers so that a lot of the restrictions that prevented us from using certain technologies, like just simple phone calls to have medical visits with patients, have been waived, and we can do those visits pretty much any way we need to. And so by that means, I think we're really able to provide a lot of health care that it's not quite the same thing as a substitute for a face-to-face visit, but we want to make sure that when people have essential medical needs that need to be taken care of, we find some way to do it. And most of our offices are now open to the extent of, for those that must have a face-to-face evaluation to manage their ongoing chronic problems like blood pressure, diabetes, and other needs. You know, we can provide that face-to-face now. So I think the individual who asked that question needs to look into whether their doctor can do a telehealth visit, can take care of their problems over the phone, and if necessary, can probably provide that office visit.
Okay. Next question up. And I'm not seeing all of these as they come in. So I am a transit driver, and I was wondering what is the best defense for me not catching this horrible virus. I'm a transit driver. I was wondering what's the best defense for me not catching this virus. Obviously, you've got not just transit drivers, but public drivers doing public buses and things of that nature who are coming in contact. I know both Indianapolis and Richmond have made some changes in their
I
public.
think the person who's sending this question, he's not asking just for transit drivers, but people who are working, and said, how do I do my job and maintain social distancing? That's very difficult to do. I think first and foremost, the transit drivers should have masks on. And try to stay away as far as possible from the customers on the bus, the riders. I recently, in fact, I think there's a directive out today, have asked everybody that's out to wear a face mask, unless you're on this show. But as soon as I leave, Eric, I'm going to put a face mask on. But I think that's an important part of social distancing. When this epidemic started, we didn't emphasize that. In fact, in many cases, we said, no, don't wear a mask. A lot of this was driven by the fact that we were so short of masks that we were worried that our first responders wouldn't have any protection. This transit driver, one of the things that he could do would be to ask people not to occupy the seats, the closest seats to him. Part of that directive that concerns me, and I talked earlier to Tom, is, what's the one time when you have to violate that 6-foot distance? It's when you're paying for something, when you're handing somebody a credit card or you're handing them money. And so I really urge and want to see cashiers and the people at the checkout windows on food drive-thrus, the people bringing food out to your car. They're seeing many, many people at a 3-foot distance, and they need to do everything they can to protect themselves.
Before we go to our next question, let's touch on a couple of things that we've had the conversation with. The whole mask issue is one that has evolved, and you're not the only one pushing it. The mayor of Los Angeles has suggested that, and some of that, I think, maybe I'd like to delve into it just a little bit. If I just go for a walk, my wife and I, we've been in the house together, we just go for a walk. Are you suggesting that we should have a mask on if we just go for a walk around the neighborhood?
No, I don't think that's necessary. I think it has to do with, we got to remember this is a droplet aerosol spread disease, and it's basically when you're going to be around other people. One of the benefits from wearing a mask is when people see you with a mask on, they're reminded that, whoa, we're in the middle of a pandemic, and they're much more likely, they're reminded to give you that 6 feet. But if you're out with your wife on a walk and you're not around other people in an uncrowded situation, if you're looking for mushrooms in the woods, Eric, leave your mask at home.
Okay. Earlier, the city and the county and they've continued to update this. They were taking some safety precautions at the urging of the health department, so they made sure to give you all credit for causing a little bit more anxiety. They've removed the basketball hoops, the playground entrances have been barricaded off, tennis courts have been barricaded, pickleball nets did not go up, and that's one of the fastest growing sports, so congratulations, you've made a lot of people happy. But it also took people off the golf course. Can you kind of talk about why some of those things were necessary?
Well, one of the people I know who also is an avid golfer said, Dave, you're asking people or telling people that they can go out for a walk. How does golf differ from just going for a walk? Well, golf is a social sport. You never see someone come to your door and saying, I was wanting to go for a walk and I'm trying to put a foursome together to do that. People golf because they like to be around each other. They watch each other hit the ball. But having said that, there is golfing going on at Forest Hills. The public course is closed, and there was a lot of back and forth between the health department and the golfers, and it was starting to consume more of my time than I had to give, and so I basically conceded that battle. But in a perfect world, which is envisioned in Dave Jetmore's mind, there would not be any golfing in the middle of the greatest pandemic of this century.
You're watching Ask the Doctors, a community update on Whitewater Community Television's WGTV Channel 11. We're also on Facebook Live. I want to turn to Dr. Huth in a minute, but there's a question. The voices in my head tell me things. There's a question that came in based on something you said. I think someone's looking for some clarifications. So what precautions should, you were talking about passing money back and forth, people giving you food. What precautions should fast food workers use to keep their customers safe for drive-through orders?
Well, I think the person working at the counter should have a mask, and you don't need a surgical mask. I think you can make a mask of your own. I think as long as it's made out of a material that you can't see light through, I wouldn't choose cheesecloth or lace for your mask material.
Thanks for that sewing tip.
Well, I didn't want you to get confused, Eric.
I know.
When you made your mask. But wearing that mask, wearing gloves, and keeping as much distance as you can, and there are ways to do this. A tray can be passed out to gather a credit card. A lot of places where I buy things now, they're not asking me to sign, which is another, passing a pen across, passing that paper. So businesses can do a lot to help customers, and the customers themselves should have masks on, and if they have them, gloves. Okay. Because this is the one area where we all have to eat. We have to sustain ourselves during this epidemic, and that's the one place where we come within 6 feet of each other, is that exchange of money for food.
And particularly grocery stores, even though the grocery stores and other shops are beginning to limit the number of people in the facility. They're changing their aisles to all go the same way. The aisles really aren't wide enough. If you pass another cart, you're within that 6-foot distance.
That's right.
I wouldn't leave out of that discussion also the hand sanitization, surface sanitization, even though you're concerned in that close proximity more with the droplet spread, there is also the high-touch surfaces, and so I've made it my personal practice that whenever I'm in those situations, afterwards I immediately hand sanitize, and so I think that's a wise thing to do. I would recommend that as well, in addition to the things Dr. Jetmore said. When it comes to masks, I think as the recommendations on masking have evolved, my own personal attitude toward it has evolved as well. And what I've decided to take the attitude is that when I'm out in a public place, I'm not sick and I'm not worried about me making somebody else sick, but how does somebody else know that I'm not sick? If I'm wearing my mask, then that gives other people assurance that I'm not, being disrespectful of them and spreading disease that I could have. And I've decided to take the attitude that I appreciate it when others are wearing a mask because I know that they're trying to protect me. So I think it's a courtesy thing at that point, even though in most situations the biggest risk is the contact spread.
You're watching Ask the Doctors, a community update on Whitewater Community Television's WGTV Channel 11, also WCTV Channel 21, and streaming live on Facebook. We're talking with Dr. Thomas Huth, Vice President Medical Affairs for Reed Health, and Dr. David Jetmore, Wayne County Health Officer. Thank you both again for being here. Before we go back to questions, Dr. Huth, I know that one of the things that people are hearing a lot about is how this COVID-19 is being treated, how you all are trying to make people better. We're hearing about blood from people who have recovered, that have not had symptoms for an additional 14 days. There's drugs, there's pills, there's... What is Reed Health doing? How are you all moving toward this?
So, obviously we're doing the support things of when people get sick enough to need ventilators, we're doing all that. Virtually all of our ICU patients get placed on the hydroxychloroquine and azithromycin both. That's the one situation where we make sure everybody gets it. But really my concern is that we need to be doing more earlier, because a lot of times when people get so sick that they begin having multiple system organ failure, there is a cascade of events happening that is kind of independent of the viral infection at that point. And so we need to be doing more to try to treat the virus before that cascade sets in. And so we are we're working with actually the Mayo Clinic. It has a protocol that we're going to be a part of that is for the administration of what's called convalescent plasma. This is a process where donors who have recovered from the virus actually have like a standard blood donation, but then that unit of blood is spun down to separate the cells from the fluid portion of the blood. The cells are given back to the donor, and that fluid portion is processed so that it can be given to somebody who's very sick with coronavirus. And theoretically, at least, that plasma has high titers of antibodies to the virus. And by that means, we hope that we can actually confer immunity, basically, into the sick person so that that person's body is better able to fight off the virus. This is something that's been done for 100 years plus. It was done in the Spanish flu epidemics in 1918, and it's been used in other situations since then. Not always successfully, so we don't know what impact it will have now. But what I can tell you is that there have been small studies done beginning in China, also in Europe, also on the west coast of the U.S., just small numbers of patients, and the results are encouraging, is about as much as you can say from a scientific standpoint. And so last week, the Food and Drug Administration gave a emergency investigational new drug track for organizations that want to put together convalescent plasma programs. Mayo Clinic put one up immediately, so we're joining that. We're going to be also partnering with the Community Blood Center in Dayton for the processing of the plasma. And I don't know when we're going to start, but we've got all the approvals, and we're setting up the system now. And I hope that we're going to be able to administer convalescent plasma in the next couple of weeks, hopefully as short as possible. Now, that's one track that a lot of physicians and organizations are interested in doing. There is still a lot of interest in the hydroxychloroquine. Mm-hmm. And what I would like to do is we give the convalescent plasma to the sicker patients, but then maybe we can move out the hydroxychloroquine to the less sick patients. And for that purpose, we're looking into acquiring an even larger supply. We have plenty for the way we've been using it currently, and also to supply medicine for those who are on it for like lupus and other rheumatic conditions. And so we're getting more with the help of the Philips Drugs folks, Peter Zaleski and his folks. They've been very helpful to help us source additional hydroxychloroquine, and there are another of individuals in the community that I would consider to be heroes in this story. Been very cooperative with us, trying to help us find the things that we need. And I'm hoping that we'll be able to give more hydroxychloroquine at an earlier stage of illness to folks who are at high risk because of their age and other problems that they have. We're also looking at using some other therapies that have been proposed, and for instance, high doses of vitamin C, some people think might have some impact, and we're looking at maybe starting up a small trial on that. And as we were starting the show, Dr. Jetmore was telling me that he's been reading some stuff about a weak diuretic medication called Diamox and whether it might be useful in helping to treat the symptoms of COVID. So we want to look at all of that because my goal is that we do what we can to prevent people getting into the end stage dire straits situation. If we can prevent that, that's the best thing for everybody.
Can you talk for just a couple of minutes about how Reed Health looks at going into some of these? Because obviously you've heard the conversation back and forth about what does work, what doesn't work. Everything is kind of trial and error to a certain extent.
Right.
You aren't able, we're in the middle of this thing trying to figure out how to make it better, so you're not able to go through all of the trials and have everything FDA approved. How do you all decide which of these sound reasonable enough to try and which of these you decide to stay away from?
We want to try to be as scientific as we can under the circumstances. You know, the proposed treatments need to have some level of sort of theoretic plausibility to begin with. And you can find things out there about, you know, drinking vinegar, and there's any number of sort of, you know, what I would categorize as maybe more folk remedy-ish. I really don't think we would see ourselves getting, you know, going down those pathways simply because they don't really have any kind of plausibility. And importantly, have no, you know, there's no even small trials been done any place. With these other things I've mentioned, there has been some level of work done with them already. And so we want to stay with what makes sense scientifically, and that's why we're focusing on the convalescent plasma. It's not a new concept, and we want to focus on the hydroxychloroquine and some of the other antiviral medications and the like. So, yeah, and we also have to recognize that we've got limited resources and time and people and bandwidth, so we've got to stick with the things that appear to have the highest value rather than chasing down a lot of little things that probably aren't going to have an impact.
The show is called Ask the Doctors, so there's probably another question out there that we probably need to bring in. Does Reed currently have any employees who have tested positive for COVID-19? You talked about this on the front side.
We do have 4. They've all, actually 5. One did acquire it in her job very early on in the outbreak, working in an office in an outlying community. But there are 4 employees who we have verified have COVID, and in all of those cases, they appear to have acquired it in the community. We're very interested to know, you know, whether our PPE is working. And interestingly, very few people who work directly in our isolation areas have complained of any kind of cold symptoms or anything like that. And if they do, we take them out and we're very cautious with them. But, you know, I think when this is all said and done and we've got a good serologic test for antibodies to the virus, I'd be very interested to test everybody who's worked in the whole organization as well as in the whole community. And I think only then we'll really know how widespread infection has been. And I would think that might give us some idea of the impact of our PPE, which are tried and true infection control techniques and equipment that have been used for decades, have been very helpful in keeping people from getting the Ebola virus, as an example. I was watching an interesting YouTube video a few days ago about a hospital in Italy where that's all they do is COVID in this whole hospital, and it was showing some of the specific protection mechanisms that they've taken, and we're doing many or most of those things. And they said that in the time that they've been doing it, which had been several weeks by that point, they hadn't had one healthcare worker come down with COVID. And that says something about their level of preparation, and also the fact that, you know, it's amazing considering how widespread COVID is in the general community and in a lot of parts of Italy. So I think the PPEs work, But I would attest that when we have that capability.
You're watching Ask the Doctors, a community update. This is our third week of this program live here on WCTV, Channel 11, also WCTV Channel 21, also on Facebook Live. We appreciate your questions, and if there's another one, let's go to it. Can the COVID-19 virus enter your body through a break in the skin? Can the COVID-19 virus enter your body through a break in the skin?
I think it can. But I think it cannot enter through intact skin.
Right.
That's my understanding.
That at least.
And that's why we're always concerned about hand washing, because if you touch and a surface that's got the virus on this, it's not going to enter your body through the skin of your hand. But then if you carry your hand up to your face, rub an eye or rub your nose, touch your mouth, that's how the virus enters your body. What are your thoughts, Tom?
Absolutely. That's the normal mechanism, certainly. I think when you talk about breaks in the skin, it may be droplet contamination of a break in the skin. I think there's some level of plausibility that you could maybe acquire the virus that way. But what we do know about the virus is that it has a core of genetic material, an envelope of a lipid layer envelope, and then what are called spike proteins that are expressed on the surface. And when you look at it, it looks like a spiky ball, if you can look at it in an electron microscope. And those spike proteins are actually they are specialized for attachment to the surface layer of tissue in the respiratory tract. That's their one and only function. So really, we're much, much more likely to acquire the virus through the respiratory system or on the mucous membranes in some way than any other way, simply because the virus has evolved to do that. I would say if I have a break in the skin and I'm doing something and concerned about maybe getting contamination by a droplet and possibly an infected droplet, simply washing my hands and cleaning out that break in the skin is probably enough to prevent actually getting an infection.
I agree with that. I think it's, the question was, could you get a virus through the break in the skin? I think you could. I think, like Dr. Hughes said, it's very unlikely. But most of the time, this is a virus we're going to inhale. That's how the vast majority of people get infected.
Okay. We're just going to go to the next question that's up. We are approximately 3 to 4 weeks into the disruption of our normal lives. Do you think people are still taking things seriously, like social distancing, working remotely, etc.? And I will kind of add to that, based on what you all are seeing. Can you give us some feel as to, I'm not going to say normal, but when things might begin to turn to a point where more people can begin to go back to work and get back to their normal lives a little bit? Can you talk about what you're seeing? And in talking about the curve bending, is it happening here locally?
Well, I think we're starting to see some signs of that globally. There's signs of, obviously this has already happened in China and in South Korea. It looks like it's starting to happen in Italy and in Spain. There's hope that New York, at the beginning of this, when you see these first, this first data where the amount of admissions is down, you don't know if that's a blip. You almost need a day or 2 or 3 to go by to see if you're actually starting to round that curve. I think the question was, are people still taking this seriously? I think people are. I think we're seeing people wearing masks. The epidemic has certainly not peaked here in Indiana, where the cases are still climbing. But having said that, Eric, I think one of the dilemmas in an epidemic like this is people start to fatigue in terms of, you know, they're tired of being inside. They're tired of watching their 90th Netflix movie. They're tired of putting together that 1,000-piece puzzle, and they're craving that normal life again. And I think we all are starting to see a light at the end of the tunnel. We just don't know how long that tunnel is. But I think this is certainly going to continue through the month of April. I think we may, at some time in May, maybe middle or late May, start to see our lives slowly returning to normal. And I have to say something about that. It's not going to be a matter of just flipping a switch and saying, okay, everybody go back to what you were doing. We're going to have to return to this in stages, in many ways the way we got ourselves here. I think probably the last thing we're going to be loath to do is having free access to nursing homes and transfer nursing home patients, because they're the most vulnerable people in this epidemic.
You know, I agree with all that, and I think if a part of the question in there is, are we bending the curve? And you know, I understand completely people are getting cabin fever and want to get back to normal lives. But I think we do have evidence that we're bending the curve. And there is some faint glimmer of hope that there's a light at the end of the tunnel. And I'll just give you a couple of examples of that. We monitor every day our volumes of the COVID known or suspected patients in the hospital. And today I've got, I think the number is 59. Only 15 are positive, known positive tested, but but many of the remainder we have a strong suspicion. But the number is 59. It's been 59-ish for almost a week now. So we went through a period where we were climbing in those numbers very steadily. But now it's kind of flattened. Where do we go from here? You know, maybe that's a lull before another storm. Maybe it's maybe it goes down from here. Maybe it stays flat for a while. But I think that's some indirect evidence that we are bending the curve, because we don't seem to be getting as much influx of highly ill people as we were kind of expecting we should have by now. Another piece of evidence of that is we monitor a website every day, an epidemiologic projection of the use of hospital beds that is maintained by the University of Washington. And you can look for the whole country, you can look by state, and basically over time what we've seen is their projections of the curve of hospital resource use have come down and narrowed. In fact, from a week ago to today, the height of their curve for Indiana is half what it was. Now they're making projections based on the practicing of the social distancing and hand hygiene and the like. And so the point is, that's an indirect measure. That's not the total cases. It's just the demand on hospital resources. Right. But in order to see that curve play out, everybody has to continue doing what they're doing.
And that's the dilemma, because when you're really the bending that curve is something that our citizens are doing. It's not us doctors that are making that happen. It's the social distancing, and the paradox is, if you're really good at that, you don't see as much disease, and when you don't see as much disease, you think, well, why do we need to do all this stuff? So that's why we need to soldier on a little bit longer.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11, WCTV Channel 21, also on Facebook Live, and we also share this program with CTV3 in Connorsville, so we appreciate them providing this information to their viewers also. I have another question for Dr. Huth that I want to get to, but I'm sure that there's at least one more question that has been called in, and we want to get to your questions. Do any of the current pneumonia vaccines offer any protection against COVID-19 pneumonia? We touched on this a little bit last week, but I think we should come back to this.
Yeah, that's a common question and not an unreasonable question, because we think of pneumonia as one thing, but actually pneumonia can be caused by many different bacteria and viruses and so forth. The pneumonia vaccine helps helps confer immunity against about 28 different forms of the one most common bacterium that causes pneumonia, Streptococcus pneumoniae. There are a number of genetic subtypes of these strep pneumo bacterium, and so that's what the pneumonia vaccine is meant to protect against. Unfortunately, strep pneumo has no part particularly in the COVID pneumonia. The COVID pneumonia, to the extent that there is an infectious component, is caused by the virus, the SARS-CoV-2 virus. And that has so the pneumonia vaccine doesn't protect against that at all, unfortunately. So what we really need is a vaccine against the SARS-CoV-2 virus, the virus that causes COVID-19, the illness. And that will be coming, but it's going to be a while, maybe a year, perhaps longer, before we have a workable candidate virus. In the meantime, we've got to use old-timey methods to avoid getting the disease, avoid passing it on, all the things we've been talking about.
Talk about, if you would, the respiratory care unit that opened up here on Chester Boulevard, and it was also announced that Reed Health would be opening up a facility like that in Connorsville. Talk about what that has done, maybe to help relieve some of the pressure on the hospital emergency room, and what are the numbers that you all are seeing from that, and will it help a little bit farther south, where the numbers, particularly out of Franklin County, which can affect this hospital, seem to be much higher than they are here in Wayne County?
Yeah, gosh, and I have to mention a couple of heroes in that part of the story. Dr. Anuradha Bandari just was this was her brainchild, the respiratory clinic in Richmond, and she has now worked with our colleague, Dr. Brad Dubois, who works in Connorsville with Reed, to set up a similar clinic there. It's not as elaborate, it's smaller, a little bit more targeted in its approach, but it's going to really offer some benefits to the Connorsville community, who heretofore have had to drive up to Richmond to participate in the respiratory clinic. But what these two clinics do is they provide an expedited way for people to be evaluated for their risk for COVID and get at least some advice on how to take care of themselves. But from our perspective as a healthcare system, what we want to do is triage people into who's low risk, who's high risk, who needs further evaluation by virtue of perhaps testing, like x-rays and such like, who needs more face-to-face evaluation in an emergency room, who needs to be considered for hospital admission. It works much better if all this takes place outside of our normal primary care and urgent care offices. Because without that, what that means is people who potentially have COVID go into our waiting rooms and potentially are a contact risk to people who are there for getting their blood pressure checked and the like. So we take and handle those separately. It's been a great improvement in the system, good for the system so that we can avoid exposing other people, but also great for the patients who are going through it because it's expedited and on target for their concerns. So we're doing that in Connorsville now. Just started a couple days ago. Still working out a couple of kinks, but I think it's going to be a great thing for the Connorsville community.
Let's go to the next question that's up. I think there's at least one more. What is the status of testing capacity for both active infections and recovered? And that's been a conversation that has been ongoing for a while. I think we just, in the state of Indiana, I think just recently reached the point where we've probably tested the number of people that actually are in Richmond, and that's throughout the entire state. So it's not a large number. We keep hearing that it's ramping up.
Yes.
Are we really seeing that, though?
I think we're on the cusp of seeing a lot more. You know, I think today we reached a kind of a high point. We have about 450 test kits available to us right now. That doesn't sound like a lot of test kits when you want to be testing tens of thousands, hundreds of thousands of people. But
That's more than the number that you had a few weeks ago,
no,
though, as I
absolutely.
remember.
I mean, we've been as low as 20 or 30 test kits at some times. And, you know, several things are happening on the testing front. One is the state's gotten much better about its testing capability, has recruited other companies into providing some of that service. That's been very helpful. The turnaround times have improved. The effectiveness or the performance of the testing has improved. And so that's good. But we need more than the current test, because really what this test does is it strictly tests for the genetic material of active replicating virus in the human body. And so what that means is the only thing we know about its value is that if you have active symptoms, you should be positive on the test. We don't know about whether the test can help us identify somebody who will come down with it, because it's known that you can test negative one day but come down with symptoms of the illness a couple days later and then test positive. So a negative test isn't necessarily very helpful to us. And then similarly, when you get better from COVID, that the test is expected to turn negative. So later on, it has really no value in telling us, have you ever been exposed to COVID? Have you ever had the illness? What we need for that are more serologic tests, they're called. That's testing for antibodies to the virus. Anything we get sick with of an infectious nature and we recover from that, the body produces antibodies to that, and we can detect those antibodies once the technology is developed to do that. A number of companies are working on serologic tests, and we expect that to be available fairly shortly. But still, there are limited supplies of those kinds of tests as well, so that they're being targeted to the much higher more highly impacted parts of the country, like New York and other places that have had really a terrible problem with COVID. So we're not in Richmond on the cusp of having generalized testing capability yet, but I think that will come soon. And I think what we'll probably see is a combination of the current PCR test for the viral genetic components plus antibody testing to give a full profile of whether somebody has recently or in sometime in the past been exposed to the virus. And another area where the testing, particularly the serologic testing, will be very helpful to us is helping to identify people who may have actually had the disease but didn't know it. They didn't get very sick, or maybe they didn't have any symptoms at all. We think as many as 25% of people who actually contract the virus don't get sick at all. So you just don't know if you've ever had it or not in that circumstance. But if we can identify you as somebody who has antibodies to it, then A, you may be able to presume that you're immune and won't get sick with it in the future. B, we can take that information and perhaps recruit those individuals into our donor plasma program to help people who are very sick with the convalescent plasma. So I'm really excited about those capabilities, looking forward to them being available as soon as possible, and I think that will really help give a lot of people a lot of peace of mind that they haven't had it or that they did have it and didn't get sick particularly. And I think will help solve a lot of problems. And I think that's in the foreseeable future, just not right now or next week.
We've got about 9 minutes left. I think probably 3 questions we need to get to, but I want to do a quick follow-up with you on the testing idea. When I first spoke with you maybe 3-4 weeks ago, you were talking about sometimes you all wanted to test someone, but you had to go to the state and they said a yes or no. Is that still the case, that when you all feel like someone should be tested, you still can't just do it? It still has to be approved through the state health department?
That is true, technically, today. But the state just decided that beginning Monday, They're not going to require that we go to the state to obtain authorization first. They're going to turn it back to the healthcare providers, still following the same rules. It should be reserved when the supplies are limited, I should say. They should be reserved for the sickest patients, for ill healthcare workers to make sure they're safe to be on the job, and for first responders, and for the elderly, those in long-term care facilities. There are certain categories of people the state wants to reserve this test for. They're just not going to require them to authorize it. They want to get out of the middle of that. That'll help the turnaround times on getting the testing done. So it will require a doctor's order, and the healthcare systems are expected to make sure that people meet the qualification criteria.
Next question up, I want to try to get to the last three that we have. Local youth leagues are wondering about summer sports. Some are looking at a June 1st, start date and have over 350 kids registered. Do you think this will be possible? Dr. Jetmore, I'm going to turn to you because you're local on this.
Well, it may be possible. I think, as Dr. Fauci always says, the virus is what decides timelines. I hope the kids can play baseball, but so much of this will depend on, that's 6 weeks away. So much will depend on what develops in the interim. That's all the more reason to double down on social distancing, masks, gloves, washing our hands, avoiding contaminated surfaces, because the sooner we let this virus dissipate through social distancing, the quicker we will be able to play ball, Eric.
Okay. Next question up. Please discuss the length of time, days, from when the COVID testing is taken and when final results are given back to the patient.
Well, it's highly variable. Well, I probably shouldn't say highly. They've narrowed that down quite a bit. Depending on what time of day the test is acquired, the sample's acquired, and when it can be couriered to the testing lab, we have gotten results back as soon as that night. They normally release the results about between midnight and 3 a.m. each day. We have occasionally gotten results back more or less within the same 24-hour period. But it still can take up to 3 or 4 days. Generally, we're not much going beyond that now from the state labs anyway. They've gotten much better at it. So I would say the average is probably about 48 hours at this point, and that's an improvement.
Number of confirmed cases in Wayne County still hovering in that neighborhood of 16 confirmed, or what's that number right now?
16.
Okay. It's been holding there for a few days, hasn't it?
Yeah, it has been, and then we're encouraged by that.
We have at least one more question, and we're probably down to about 5 minutes. As healthcare professionals, what would you say to people who believe this is a hoax or some conspiracy? This ought to be good.
I would say come over to the hospital. Let me give you a tour of our isolation wards, particularly the ICU, where this morning I have 9 patients on ventilators with COVID. They're all positive. And some of them have been on a ventilator for as long as 2.5 weeks. 2 of them have trachs. And this is highly, highly unusual for us. On a normal day, we might have 2 or 3. And they don't stay on ventilators for a long time, typically. So this is an immensely unusual situation. And I would say also, let me take you to a nursing home in Greenville, Ohio that has an outbreak. And they have 30 cases and have had 5 deaths so far. So this virus is no joke. And even though you or I might not get very sick if we acquire it, we're a risk to others, particularly the elderly and infirm. And so we must take this seriously.
Dr. Jetmore?
Well, Dr. Huth is right. I mean, this is obviously not a hoax, it's also it's not a conspiracy. I've heard people say that this was escaped from a laboratory in China and somehow made it into the population. I've heard other conspiracy theory ideas on this, but they're untrue. I mean, this is a virus that took origin in animals, probably bats, and transferred to anteaters and somehow got into the human population where it began to transfer between people. It's not a conspiracy. Nobody made that happen. It's something that happened. And it's happened before with SARS and MERS viral epidemics. So that's all I have to say on that, Eric.
The conversation, and we're under 3 minutes, that has been going on this week nationally is the fact that particularly in the African American community, there was a myth, I think we can call it, going around that African Americans or people of color could not get this virus. Can you speak to that?
I had not heard this, but I saw on television several prominent African Americans say, yeah, their friends and many people said that this was the case, but then pointed out that the first person who got COVID in Chicago was an African American woman, or probably the first death. So obviously, Eric, this is not the case. This affects all races equally. And I don't know where that myth started, but apparently that was a common myth. One of the things that was brought out is that the number of deaths in the African American population is very high considering their numbers. I think they make up, African Americans make up 30% of the population of Chicago and suffered 70% of the mortality. And this was, I think, there were many reasons used to explain this. One, that there's a higher incidence of high blood pressure and diabetes in African American people. But I think also many of the African American people don't have as good as access to medical care, and that may play a part too. I think there'll be a lot of things learned as this epidemic recedes and we look back on this.
I'm going to have to cut you off there. Dr. David Juttmore, Dr. Thomas Huth, back with Ask the Doctors, a community update. We'll be back next Friday at 2 p.m. Hopefully you will be able to join us here on WGTV Channel 11. Thank you very much for watching. I wish you well.